In this section of the video, we will demonstrate several types of functional transfers using dependent and stand pivot transfer techniques. There are various methods for safely performing transfers. The technique used for each patient is determined based on the following criteria: the patient's disability, upper and lower extremity strength, physical endurance, trunk balance, body type, orthotic devices, and wheelchair style. The stand pivot transfer can be used with patients with lower extremity deficits as long as the patient can support his or her weight on one or both legs. This stand pivot transfer from bed to chair is performed with the therapist in front of the patient and the transfer surface as close as possible. Notice that the first thing the therapist does is to apply a transfer belt securely around the patient's waist. The therapist bends her knees, keeps her back straight, and grabs the transfer belt. She then helps the patient to lean forward and, using some momentum, assists her to a standing position. Once the patient is standing, the therapist helps the patient to swivel toward the transfer surface and guides her hips down as she is being seated. This is a demonstration of a stand pivot transfer from wheelchair to toilet. It is performed with the same technique that was just described. Notice that during this transfer, the patient is using her upper extremity strength to push off from the armrests of the chair and gain momentum to perform the transfer. Also observe how the therapist helps the patient scoot back completely onto the transfer surface. Here the therapist is demonstrating a stand pivot transfer in which she positions herself alongside the patient. Again, the patient is able to push off from the armrests into a standing position. When performing any transfer, the therapist must be sure to position herself correctly, or the transfer will not go smoothly. The dependent transfer is used for a patient who cannot assist in the transfer and therefore requires complete assistance to move to various surfaces. In this dependent transfer from bed to wheelchair, the therapist stands in front of the patient. The first step is to position the patient's trunk in forward flexion so that the chest is lying on the thighs. Here the therapist is holding on to the waistline of the patient's pant for support during the transfer. The patient can also be supported under the buttocks at the ischial tuberosities, as shown here. The therapist then blocks the patient's knees and rocks the patient forward, lifting and placing the patient's buttocks closer to the transfer surface in small increments in order to reduce the chance for injury. As demonstrated here, a transfer board can be used to bridge the gap between transfer surfaces while performing a dependent transfer. Use of the board can increase ease and safety for both the patient and the therapist. The same dependent transfer technique can be used for a chair-to-car transfer, though it can be more difficult to perform because of the wider gap between surfaces. Notice that despite more limited space, the therapist continues to reposition herself in an effort to perform the transfer correctly and reduce the chance for injury to herself and the patient. The dependent transfer may also be performed using two caregivers. The same dependent transfer technique is used, but includes a second person, who positions him or herself behind the patient and places his or her hands under the buttocks on the ischial tuberosities. Both caregivers then lift and move the patient in small increments toward the transfer surface. Now that you have seen several types of transfers, remember that no matter which transfer is being used, good communication is key.